Hi, I'm Dr. Zachary Macchi. I am a research fellow, as well as a clinical researcher within the CU Alzheimer's and Cognition Center. And I wanted to talk briefly about the importance of advanced directives in communicating your wishes for your care to your medical providers, your doctors, and any other people involved in your medical care. Advanced directives essentially are formal forms or documentation that describes what would I want in the future for my medical care if I was unable to speak for myself. And so, in effect, you're essentially communicating down the line in the event that, for whatever reason, you're unable to have a conversation with your family, your loved ones, your doctors, or other medical providers to tell them during specific points in time where medical decisions need to be made, what would I want for my care? Everyone is different in what they wish and desire, what their values and goals are. And so, in effect, these forms, these advanced directives, are a means to convey those wishes, desires, and values to others, especially for those who maybe have just been diagnosed with mild cognitive impairment or even early stage dementia like Alzheimer's disease. It's especially important to have these conversations early on and to get these sorts of values, goals, and desires for care in writing in the form of various types of forms and documents early on, so that it curtails any future problems with being able to discuss these topics. And there are a variety of different types of advanced directives. Some folks might be more familiar with things like a living will, where you actually go into very good detail about what sort of care I would want, what I would rather avoid in terms of the future. And then there are other forms, some vary from state to state, that actually describe physician orders for care and treatment. So, specifically talking about what would I want in terms of code status if my heart were to stop, or if I were to stop breathing. Would I want CPR? Would I want a ventilator to help me breathe? And also touching on fluids, nutrition. Would I want antibiotics? And who is the designated person to make decisions for me? And then finally, we also have more sort of informal types of advanced directives. One example being the Five Wishes document that's out there and accessible on the internet. And it goes into even more detail where you actually can describe in your own words what sort of care I would want in the future. As I mentioned, it's really important to have these discussions early on and to involve your medical providers, your doctors in these discussions so that you can explore any questions as they arise, but then also make sure your doctors and your medical providers are well informed and have these documents in your medical record for reference later on. Essential to all of these types of forms and really all advanced directives is the designation of somebody to make decisions for you. Of course, these forms don't touch on every sort of decision that needs to be made in the future with regards to medical care, and it's important to establish who would be the designated person, your medical proxy, to make these decisions for you. I would encourage people to look to their loved ones, people who know you very well, know where you stand in terms of your values, and have had discussions with you about these sorts of topics, because those are the folks who are really going to know what you would want for your future care and the medical decisions that will ultimately arise in the future if you were unable to make those decisions for yourself. And so, advanced directives in this way, as I mentioned before, are a good way to communicate to others around you what sort of values, goals, and wishes I have for my care in the future. And in that way, you still have a meaningful participation in these discussions, even if you are unable to do so in the moment, but at least referencing your past self and what your desires and wishes are in the present, thinking forwards into the future.